This AI doesn't ask your age, it doesn't look at your medical records, it just listens. And somehow it knows, not how you'll die, but when, with surprising accuracy. You may think this is science fiction, but it's not. Doctors are testing it, hospitals are using it, and it could change medicine forever. Imagine going to the doctor, you answer a few questions, maybe speak into a mic, and then the computer says, "You have a 73% chance of dying in the next 12 months, not based on symptoms, not from scans, just from your voice, your tone, and a few patterns in your answers." Sounds impossible? It's already happening. Let's explore the rise of predictive death AI, how it works, where it's being used, and what it means for medicine, ethics, and the future of human life. The first major breakthrough came in 2019. Researchers trained a neural network using 175,000 patient records, including hospital visits, test results, and eventual outcomes. The goal? Teach an AI to predict who would die within 1 year. The results were shocking. The AI was 95% accurate in identifying patients who would not survive the next 12 months. Even more surprising, it often picked up on hidden warning signs doctors missed, like combinations of symptoms that didn't seem related. Since then, dozens of AI models have been built with one eerie goal: predict death before it happens, and not just in hospitals. So how does this work? What data does the AI use? Most of these systems rely on machine learning trained on thousands, even millions of medical histories. They analyze lab results, medication patterns, hospital visits, speech tone and breathing rate, behavioral changes over time. Minor symptoms most people ignore. Some AI models even detect subtle vocal markers that correlate with heart disease, neurological decline, or depression, long before humans notice. One study found that just 20 seconds of voice data was enough to predict major cardiac events. Another model could forecast death risk using only electronic health records, with no need for a doctor's opinion. It's not magic, it's pattern recognition at superhuman scale. This isn't theoretical anymore. In the United States, systems like Advanced Care Planning AI are being tested in major hospital networks. In Canada and the UK, predictive models are used to flag palliative care patients, helping doctors start tough conversations sooner. Life insurance companies are even exploring the use of death-predicting algorithms to determine premiums. Some companies like Sond Health analyze vocal biomarkers through phone apps to track mental health and chronic illness risk over time. Meanwhile, AI is also being tested in emergency rooms, helping triage patients before human staff even see them. And in a pilot study at Stanford, predictive AI helped reduce end-of-life suffering by improving when patients were transitioned to comfort care. In short, it's already here. So is this a good thing? In many ways, yes. Knowing when a patient may die can help families prepare, trigger earlier palliative care, reduce unnecessary treatments, improve quality of life in final months, make organ donation planning more effective, and allow patients to have final conversations while they still can. Doctors often struggle with when to have the talk. AI can gently trigger those decisions earlier, with data, not guesswork. And it can reduce guilt for families by helping them understand what's coming. In a strange way, death prediction AI can actually bring peace. But there's another side to this. What happens when a machine tells you you're going to die, and it's wrong? False positives could create panic. False negatives could delay critical care. There are also ethical questions. Should you be told your death score? Can employers or insurers use it against you? What happens if people make life decisions based on AI predictions, and regret it? Then there's the psychological impact. Would you want to know? What if your chart said 82% chance of death in 9 months? Would you quit your job, get married, say goodbye, or would you live in fear? Some experts worry this kind of AI could create a death anxiety epidemic, where people obsess over scores like they do with step counts or credit ratings. And then, there's the government. Could authoritarian regimes use death AI to triage care or deny it altogether? The technology is powerful, but in the wrong hands, it's terrifying. Whether we like it or not, this is the future. AI will soon play a major role in predicting death, preventing it, preparing for it. Companies are already working on consumer versions, apps that track your risk level, emotional health, and behavior to forecast longevity. Wearables may soon alert you when your risk spikes. Your doctor may quietly receive your mortality rating before you sit down. And in the next 5 to 10 years, AI may even become part of legal end-of-life decisions, informing families, hospitals, and governments. What's at stake isn't just technology. It's how we think about mortality itself. Will we use it to live more intentionally, or will we become addicted to prediction? That's the real question. Here's the truth. AI can already detect disease better than most doctors. It can already forecast economic crashes and storm paths. So maybe it was only a matter of time before it started forecasting our lives. You don't have to be afraid of this technology, but you should be aware of it, because in the near future, knowing when you'll die may be as easy as asking your phone. And that reality, as strange as it sounds, is almost here. If you found this video insightful, subscribe, because the age of predictive AI has begun and we're just scratching the surface. Like, share, subscribe for more.